Thank you, Madam Speaker. And Madam Speaker, cyclones are part of life here in the Territory, but so too is resilience, the grit and the unbreakable spirit of Territorians. Every time a storm, an emergency or a disaster comes our way, we see the same thing. People stepping up, looking out for one another and doing what needs to be done to keep their families, their neighbours and their community safe. I was so pleased to see so many Territorians prepared early, acted responsibly and followed the advice of our emergency services. That preparation made an enormous difference. It meant we were ready. Being prepared made all the difference when it counted. It meant our communities were safer and it meant the path to recovery could begin sooner and with fewer setbacks. Reviewing our household plans, securing our homes, staying informed, helping neighbours and preparing early. Those are the actions that save lives and protect our communities. I want to acknowledge the tireless work of many workers who worked around the clock to help Territorians during Cyclone Fina, and particularly acknowledge the work that took place in some of my portfolio areas, in health, in housing and local government, both here in Darwin and our rural and regional areas, and indeed the remote communities. To the power and water, the linesmen that are out there that have been doing the job that's needed to get power back on, to all of those frontline workers, thank you for the work that you've done, thank you for the work that you're doing. When it comes to health, Madam Speaker, since I became the Minister, I've been briefed on many occasions about NT Health's strong cyclone and emergency management plans for the Royal Darwin Hospital and Palmerston and for our remote health communities that were enacted in preparation for the cyclone. I was advised the NT Health enacted what is known as a Code Brown at RDH on Saturday morning, as is their practice in weather events such as Cyclone Fina. Once the immediate danger had passed and the conditions eased, the Code Brown was stood down on Sunday morning. As per Code Brown protocols, I understand that many staff at the hospital between shifts were sleeping in the auditorium. They spent the night at the hospital, just to ensure they could be there to care for patients who need care when their shifts commence across the course of the cyclone impact. Madam Speaker, more than 800 staff worked or sheltered across the Royal Darwin Hospital and at Palmerston during the cyclone. So thank you to all of those staff, those that not only did their job, they stayed there overnight to support every patient in our hospital. They didn't go home, they took their bedding to the hospital and stayed there to ensure that support was available. So thank you. As has been reported, Madam Speaker, a small section of the ceiling collapsed on the first floor near the lifts of the Royal Darwin Hospital during the cyclone on Saturday night. A portion of the external brick cladding on the main building of the hospital loosened and fell onto the roof of the first floor theatre building. The bricks came through the side and ceiling of the first floor corridor, and thankfully no patients and no staff were injured. It's incredible, Madam Speaker. The area is a well-travelled area at the hospital, but nobody was injured, and I'm pleased to advise that. Madam Speaker, a small number of elective surgeries, around 16 surgeries were postponed yesterday as a result of the cyclone issues. But Madam Speaker, the RDH, our incident management team, has taken steps to ensure the safety of our patients and staff. All of that area has now been isolated while safety checks and repairs are being completed. Structural assessments have commenced immediately and they are continuing as we speak. The Royal Darwin Hospital will be guided by the Department of Logistics and Infrastructure, engineers, as to the repairs required and the timeframes that will require. Hospital operations continue with alternative routes in place for staff and patients. A short stay ward of 16 beds was disrupted due to the ceiling damage. This led to elective surgeries being transferred to Palmerston Regional Hospital on Monday, with a handful being rescheduled. I'm advised by Health that elective surgery from today has now resumed and is back to normal. Engineers are continuing to inspect the areas of the external facade to review it and ensure that it's safe. I want to reassure Territorians and patients and staff are safe at RDH during cyclone events, and that the RDH was built to withstand Category 5 cyclones. Madam Speaker, I understand all visitors were allowed to resume their visits to patients yesterday, and normal visiting rules do apply. I can say during Cyclone Fina, and I think the member for Karama raised this, there were 5 babies born on Saturday night, Madam Speaker. They were all girls, member for Karama, but none of those were named Fina. But throughout the weekend there were 9 babies born altogether, so I thank all of those staff in the maternity ward for the work that they've been doing. Incredible work, 9 babies born over the weekend, so well done to all of those families and all of the staff that were there to assist during those very important times. Madam Speaker, new Territorians have already seen their first cyclone. On Sunday I dropped into the hospital. I dropped in there to speak personally to the incident management team and thank them for the work that they did during Cyclone Fina, and being there just to, I didn't get in the way of what they were doing, but what I did want to do was just thank them for the work that they did. And that's what I did. The incident management team had stood up, been meeting regularly, dealing with the issues at hand, and all credit to the incident management team, but all credit to all of the staff involved in dealing with the emergency and the issues on a day-to-day basis at the hospital. When it comes to essential services, power and water crews working on the ground conducting repairs have worked day and night since Sunday to restore power. As of Tuesday, I'm told that 14,900 customers have been restored since Tropical Cyclone Fina. I'm assured that Power and Water are working very hard to restore power, and those that have been out and about have seen those Power and Water frontline workers out there doing what they need to do to restore power. So thank you for the work that you're doing. Team members have come up from Alice Springs and Tennant Creek to help out, so we have the resources on the ground. Additional resources have been deployed to Tiwi Islands and impacted communities to assist with power restoration. Darwin's water supply has been confirmed as operational with no interruptions to the required supply. Madam Speaker, I want to note that our remote communities haven't been forgotten. Power and water teams were dispatched to Warramayunga to inspect and repair impacted assets and restore power systems, and we heard the Chief Minister speak about that this morning. More resources and equipment have been sent over yesterday to Warramayunga to assist with the effort. Damage assessment teams from housing have also been deployed to look at all of the damage as a result of Tropical Cyclone Fina. When it comes to housing, I'm advised that, Madam Speaker, on Friday our housing teams, and particularly the public housing safety officers, made contact with more than 700 vulnerable residents across properties on Friday to check in on them and assist and provide information about preparation for the approaching cyclone. On Sunday, housing started conducting patrols of public housing complexes to review damage, and public housing safety officers have reactivated their daily patrols. There's been no reported damage to large public housing complexes, although there have been reports of minor damage in some of the suburbs, and of course we know that there's still a number of fallen trees in those areas. Housing maintenance received 54 calls relating to fallen trees, damaged fences, roof leaks or blocked access. Madam Speaker, I have been delighted to see that the generosity and community spirit of Territorians has once again shone, and it makes me very proud with offers of help from fellow Territorians from down the track. In events like this, whether it be your neighbour in your street or a fellow Territorian from the next town that comes to help, it shows how Territorians help each other when the going gets tough. So I thank all of those Territorians that have been out helping, working in their own time, volunteering their time, assisting not only vulnerable residents but assisting their neighbours, the community, and doing the work that they don't have to do, but they're out there doing it. And I thank every Territorian for the work that they've been doing, responding to the Cyclone Fina thank you very much. Thank you to all the services and all the volunteers. You've done a great job.